GPS, psychological public health and society thoroughness are the services to get the largest increases in financing as portion of a new length-term schedule to major repair the NHS. The aim is to restrain the trust on hospitals, that will get a less cut of the budgeting as public health chiefs major repair the way the facility plant in England. NHS bosses say it will start a more attention on prevent bad health, and could rescue up to 500,000 lives. But elder doctors told hospitals were cladding a close-on unfeasible problem. Community of Severe Medical CEO Dr. Nickname Scriven told he was staggered by the plans taking into account the problems cladding hospitals. Lot trusts are lacking all three key wait period targets for ONENE, carcinoma thoroughness and usual operative, and are fighting to balance sheet the books. The complete detailed information of the schedule are to be opened after by NHS England Head Execution Simon Stevens and Main Secretary Theresa May. But front of the publishing, NHS England affirmed a tertiary of the additional £20 billion the NHS will get in 2023 will go on GPS, society thoroughness and psychological public health. Now they expense for less than rather than a block of conducting time hospitals get up about part of the £114 billion frontline budgeting. NHS England told conducting on hospitals would yet growth common, fare not as rapidly as some areas, and how in rotate would ease the blood pressure on hospitals and build a brand new pattern for the 21SAINT age. Mr. Stevens named it a pragmatic, costed and gradual path card for the 10 years front. Psychological public health is due to get additional of the £20 billion time GP and society thoroughness is to get NHS England told how will assist pay to. NHS England believes combination the new site could rescue 500,000 lives via prevent diseases, such as strokes, cardiac problems and carcinoma, and spot them over to enhance the chances of surviving. As health politics is politically devolved, the schedule just applies to the NHS in England. But some UK nations are figure up their own plans. By the government's financing framework they are receive an additional £4 billion among them by 2023. The Main Secretary requested for the schedule to be painted up while she opened additional financing for the public health facility in the summer to mark its 70th date of birth. The budgeting will increase by £20 billion a year by 2023, the counterpart of yearly rises of fare by 3.5%. She told a length-term schedule for the following 10 years was necessary to provide the cash was sagely consumable. The recent period a 10-year schedule was set out was in 2000 by Tony Blair. Talk on the schedule on Saturday, Mrs. May told it was a historical time for the NHS and would assist pay for planet-grade treatments. But Dark Public Health Secretariat John Ashworth told the schedule lacked both of the personnel maintenance and financing to prosper and charged by the government of poor management of the public health facility. This NHS as necessary a plausible completely funded schedule for the next, not a desire listing to assist Theresa May get via the upcoming months. The ambitions are creature welcomed. Professor Carrie Maswan, of the Academia of Care King Colleges, told, "It's nice to include a schedule that sets a precise line for the NHS. But unions alerted the labour shortages could erode the programme, now 1 in 11 posts are vacant." Toon Chief of Public Health Sarah Gordon told, "Out of the personnel, down there is no NHS. Ministers must say more than on how they schedule to address the personnel maintenance shortages. Down there is as well anxiety how some components of the broad public health framework been cut. The £20 billion pledge just applies to NHS England's budgeting for frontline public health thoroughness. It does not lid some areas such as learning and social public health. The cash done accessible to councils to pay for initiatives such as smoke termination and wholesome way programs is creature cut by more than rather than 4% following year 1 day bloating is undertaken in expense. Which is more than, by the government has yet to issue its verdant document on public thoroughness in spite promise to in 2017. Councils and thoroughness homes include alerted thoroughness homes and household assist services for the old and adults in disabilities are at hazard since of inadequate financing. Chris Hobson, head execution of NHS providers, that public health link, told the attention on of hospital thoroughness should assist ease the pressures on hospitals. But he added, if we are severe on help human beings to remain so and dwell alone for as length as probable, it is urgent how we as well see relevant invest and supporting for public thoroughness and social public health.